Senator Urquhart.
Thank you, Mr Deputy President. I rise to speak on the Personally Controlled Electronic Health Records Bill 2011. E-health is an integral part of the Australian Government's agenda for health reform, an agenda that aims to create a continuously improving healthcare system for the 21st century. A system that is accountable, affordable and sustainable, with safety and quality at its centre. The Personally Controlled e-health record system is the next step in using e-health to enhance the healthcare system. This key infrastructure reform is of vital importance to the future of how our health professionals provide their services in Australia. It creates the capacity for a patient's shared health record to be available securely over the internet, where and when it is needed at the point of care. The first release will deliver the core functionality required to establish a system which can grow over time. It will benefit both patients and providers through a secure opt-in system. A patient or their nominated representative will be able to register for an e-health record and to control the access to that record. Individuals can choose whether or not to have a personally controlled e-health record. If they choose to participate, they will be able to set their own access controls or allow default access settings to apply. With the individual's permission, key pieces of health information may be viewed by participating healthcare providers across different locations and healthcare settings. This will remove the paper trail between health professionals, removing the need for pharmacists to squint when trying to make out the doctor's handwriting, as Senator Di Natale has raised, but importantly ensuring that the correct information is transferred between health providers. It will limit the need for patients to have to retell their story if they need to see a different specialist or GP, taking some of the burden out of seeing a new doctor. It will create synergies between a community mental health nurse who has assessed a patient at their home with the psychiatric unit of the local hospital. It is a pleasure to be speaking to these bills only a few days after Minister for Health Tanya Plibersek, together with my Federal Labor colleagues and I, announced a $325 million assistance package for the Tasmanian health system. A key aspect of this assistance package is to build on the tremendous work of the North West health professionals and provide resources to speed up the rollout of e-health records to patients across the whole of Tasmania. A great example of how e-health can assist isolated communities with limited health resources is evidenced in Smithton in the far northwest of Tasmania. For example, Smithton is a small community with approximately 3,500 people and is serviced by a 4-doctor general practice. The same GPs provide services at the local aged care facility, Emerton Park, and also at the local community hospital, which is located adjacent to Emerton Park. As it is a small community, the majority of residents of Emerton Park and patients presenting to the community hospital are also patients of the local general practice. Before the NBN connected the hospital, Emerton Park and the general practice, doctors had not been able to access their existing patient notes when visiting Emerton Park and hospital due to variable and slow broadband, which meant the full patient history, including test results, had not previously been available to them. This has provided the opportunity to implement technology using the NBN, which will allow GPs to access their practice notes at both Emerton Park and the community hospital and print prescriptions on-site if required. The solution involves implementation of iPad 2 technology at Emerton Park and community hospital with virtual private network software to enable a quick remote connection to the practice system via the NBN. A wireless printer on site will enable printing of prescriptions which the doctor can sign while in attendance. The iPad 2 technology will be duplicated at the practice so that the camera features may be used for consultation with their colleagues if required. The Cradle Coast Electronic Health Information Exchange for North West Tasmania has been a collaborative project of the UTAS Rural Clinical School, the General Practice Northwest, the Northwest Area Health Service and the Cradle Coast Authority. The Information Exchange support team has had a very positive response from GPs, allied health professionals and specialists. Traditionally, the Tasmanian divisions of general practice have not worked with specialists and allied health professionals on collaborative IT initiatives. The North West Division engaged with the Cradle Coast Authority and with general practices, specialists and allied health professionals to install, train and support the uptake of a common secure messaging platform, therefore achieving the right balance between technology and the personal aspect of e-health initiatives was at the fore of the support officers' work and increased the uptake of the new system. The platform enables patient referral letters to be sent electronically rather than using traditional paper-based processes. Electronic referrals jumped from under 400 per month to 2,500 per month in just 12 months because of the hard work of the support officers with individual practitioners and their practices adapting IT solutions to existing business processes. A specialist practice has reported time savings from eliminating printing, folding and putting letters into envelopes and reduced their monthly postal costs by $300. E-health teams are encouraged to focus on the personal side of IT and go over and above installing software and providing instructions. It does take time and effort, but the initiative has been embraced by healthcare providers, and this pilot will be used across the nation as this bill is enacted and the national e-health rollout continues. During a recent spell of hospitalisation, I had a facial X-ray scan at a medical imaging facility. I was very surprised that there was no requirement for me to wait around for the slides to be processed and printed. No carefully carrying those slides between the imaging facility and the specialist. The e-health link between the medical imaging facility and the specialist surgery was so comprehensive that by the time I had arrived for the appointment the next day, the specialist had already had time to study the images. He conveyed to me his enthusiasm for the arrival of the NBN and how this would enable more comprehensive e-health records. It will make it easier for him to communicate with other specialists in the community sector, in private practice and in hospitals. The assistance package announced by Minister Plibersek last week in Tasmania will see an additional $36.8 million over 4 years used to roll out the personally controlled e-health record in Tasmania's hospitals and enable allied health, pathology and diagnostic imaging services to connect to e-health. In consultations with Minister Plibersek, frontline health professionals from surgeons, psychiatrists, paediatricians, social workers and emergency department nurses all emphasised how enhanced e-health records will reduce errors and duplication and improve the efficiency of their work. Together with the funding for e-health records, the package will deliver $31.2 million for an elective surgery blitz, providing about 2,600 additional surgeries targeted at areas where there are large numbers of patients whose surgery is overdue, such as orthopaedic and cataract surgery. Around $22 million to establish walk-in clinics in Hobart and Launceston, to provide care for minor illnesses and injuries over extended hours and at no charge to patients, alleviating the pressures on emergency departments. $48.7 million over 4 years to the Tasmanian Medicare Local to support better care in the community to prevent and manage chronic disease. Individual GPs will continue to have central responsibility for the clinical care of their patients, with the Tasmanian Medicare Local supporting allied and preventative health services and the coordination of care. Additional support will include providing strength development and fitness programs for frail, older Tasmanians and addressing smoking, excessive alcohol consumption, physical inactivity and poor diet. $74.5 million to provide better care for patients when they are discharged from hospital and better palliative care in the community. The Tasmanian Medicare Local will help build and support better links between hospitals and GPs by ensuring that appropriate follow-up care and services such as rehabilitation are available post-hospitalisation. This is expected to reduce avoidable readmissions to hospital. Expanding access to community-based palliative care services will enable people to remain at home if they wish at the end of life, with support for health professionals to improve palliative care skills and support for electronic advanced care planning, building on a model pioneered by the Cradle Coastal Authority and Northwest Area Health Service. $53.9 million to train more medical specialists in Tasmania and provide more scholarships for nurses and allied health professionals. Up to 132 undergraduate clinical placement scholarships per annum, up to 48 postgraduate scholarships per annum, and up to 70 continuing professional development scholarships per annum. $15.4 million that will target service gaps in mental health services and population groups who currently have poor access to mental health services, and $42 million to support innovation in clinical services that would enable care to be delivered more effectively and efficiently. This will include $1 million in seed funding to establish a virtual health sciences precinct, bringing together Tasmanian hospitals, the University of Tasmania Faculty of Health Science, the Menzies Research Institute, the Clifford Craig Medical Research Trust, and appropriate primary care providers. This funding will provide both a short-term boost to elective surgery and increased rollout of e-health records, as well as a plan for how we can manage the long-term issues Tasmania faces with its older population, higher rates of chronic disease and system constraints. The funding addresses concerns raised in conversations across Tasmania with health professionals. On the northwest, 18 health professionals joined Minister Plibersek in a small workshop room in the Northwest Regional Hospital's Medical School. Joining the hospital's Director of Surgery and Northwest Area Health Service CEO were frontline nurses, doctors, allied health professionals, public servants, private practice operators, and those who worked in both. There were people interested in research, those keen to just get things rolling again, and some who wanted to revolutionise the system. They were all united in a desire to rebuild Tasmania's health system both for their community and for their colleagues. Gone were the squabbles between doctors and nurses. This meeting presented a united front to the Minister and demonstrated just why Tasmanians and Australians should be very proud of our health professionals. I was very impressed by the constructive attitude on display that was not about a handout to patch up the issues. The focus was on targeting the areas that would give the greatest return for the Commonwealth dollar, if it were to be forthcoming, and of course seeking the greatest return for the health of people in Tasmania and specifically in my area, the North West Coast. There was no desire to seek undue credit for anything, but a real sense of this was our time to explain to the Minister what we really need, what we really do well in North West Tasmania and what we need help with. We heard that there is no point throwing lots of money at elective surgery when there are also significant bottlenecks both in preparing someone for surgery and rehabilitating them afterwards, as well as the important facet of our health system of trying to keep people well and out of surgery to begin with. And that is exactly why systems research and e-health infrastructure is desperately needed to be expanded. North West Tasmania is leading the nation in the rollout of e-health infrastructure and capacity. E-health makes getting treatment simpler for patients and delivering treatment easier for health professionals. This is another positive reform being brought about by a Labor government that is committed to improving the health outcomes of Tasmanians, both now and in the long term. I commend the bills to the House.